Hello, everyone. On behalf of the entire team at GC Media Group, it gives me great pleasure to welcome you all to this webinar on the next wave of transformation in healthcare with artificial intelligence. We welcome our community across the globe, and our foray in Southeast Asia and India in the last 2 years has seen some incredible growth with the support of our global CXO community, industry players, stakeholders, and our country partners. The webinar today is brought to you under the flagship digital magazine, Business Transformation Asia, having a footprint across 20 countries. Our objective is to partner with businesses, consultants, and technology vendors to enable the process of transformation and business restructuring for the digital age. Business Transformation Asia showcases how success can be enabled when organizations are ready to rebuild themselves using new technology platforms. As a repository of content, the magazine is focused on showcasing the full stack of milestones along the road of organizational transformation. We at GC Media Group, through our magazine's editions of Business Transformation Asia and Titans Asia, are dedicated to the region of Southeast Asia and India to bring technological solutions, transformative learnings, and perspectives to our community. We are committed to highlight discussions on how business, technology, and customers go hand in hand in the large surge of transformation. We have embarked on a strong expansion plans, and as travel is getting easier, and as the Southeast Asia region and India is opening up, we are curating events, roundtables, and fun times for all of us to bond together. Do look out for our announcements, to reach out to us with your stories, and we look forward to your participation so we can showcase excellent work being done by you all. So let's start, and this webinar today explores the next wave of transformation in healthcare with artificial intelligence, and it highlights the complexity and rise of data in healthcare. It means that artificial intelligence will increasingly be applied within the field. Several types of AI are already being employed by payers and providers of care and life sciences companies, as AI has the potential to radically alter the field of healthcare. We have an excellent lineup of speakers today, and I'm delighted to introduce you to our moderator for this webinar, Santosh Nair, Head of Innovation and Process Consulting, APAC. Santosh is a technologist who focuses on human-centered approaches to transformation and change over the last 3 decades of his career in information technology. From enabled software development, sales and account management, to leading teams across Asia Pacific, Middle East and Africa, to being engaged in various regional and global transformation initiatives, Santosh brings a diversity of experience spanning markets, industries, technologies, and cultures. His work spans different industries like manufacturing, airports, banking and IT services, and of course, healthcare. Today, Santosh works with Siemens Healthineers, leading the portfolio of IT innovation and process consulting across Asia Pacific. And in this role that he assumed just a couple of weeks ago, Santosh and his team will focus on holistic digital transformation for the Siemens Healthineers business, people, and processes in the region. Welcome, Santosh.
Thank you, Malvika. Thank you so much.
Always a pleasure to connect, and over to you.
Thank you. Thank you so much, Malvika, for that kind introduction. And hello, everyone, from my side. It's nice and sunny here in Singapore, and I hope that all of you are keeping safe and healthy. It's absolutely my pleasure to be here and to be able to share this stage with some really prominent and illustrious professionals from the healthcare fraternity. On behalf of Business Transformation Asia, I welcome all the attendees to this virtual summit on the next wave of transformation in healthcare with artificial intelligence. Now, before I go on further, like I said, I hope all of you are keeping safe. The last couple of years have really disrupted a lot of activities that we had as a norm in the past. And that's something that norm cannot be taken for granted anymore. Now, of course, things are changing. We are hopefully coming to the tail end of the pandemic, but then the world is still facing tremendous challenges from both man-made and natural, let's say, causes. Man-made causes are something that we can manage. And I really hope that sooner than later, things become a lot more normal than what it is today for all of us around the world. Now, in a way, the last 2 years, leaving aside all the negative effects that it had, what we have seen really is that there was a huge adoption of digital across the globe, and that's unprecedented, right? But at the same time, we also know that the challenges cannot be resolved with technology alone. While digital acceleration and adoption happens, the fact that maturity and the availability of technologies, access to technologies, is different in different industries. Clearly, finance or travel, banking, and a few other industries, we have seen a much higher adoption of digitalization or even digitization, but not everybody has been able to pivot to the digital agenda. Nevertheless, when we look at the healthcare industry, it's also not very different. Technology has been part of the healthcare industry for a while, and digital transformation is also not new in the healthcare space. But it varies depending on the markets, the healthcare system of the countries, and down to the processes that are affected by digitalization. Now, to a person on the street like me and you, to me, healthcare is all about prevention, diagnosis, treatment, care. And for all these processes that are kind of geared towards my well-being, your well-being, our collective well-being as an individual or even as a society, digital technologies and specifically AI, artificial intelligence, can play a very significant role. And that's what we are going to hear about today. You're going to hear about that from really 3 distinguished speakers who have actually taken on digital transformation and including AI into their portfolio for the last few years, and have really come up with activities and solutions in the industry which actually are quite trailblazing. Now, they will be speaking to us about their journeys, their views, their opinions on the state of digital adoption in the healthcare industry, and primarily in India. The 3 distinguished speakers are Professor Dr. Ashok Chaudhary of Narayana Super Speciality Hospital, Gurugram, pardon me, Dr. Sushil Maher, AIIMS, and Dr. Ashok Sharma from the National Cancer Institute of India. I will introduce them individually and their topics as I invite them on stage soon. But then before we begin the summit, here are some housekeeping messages. All attendees are on mute throughout the virtual session, but we would like to really hear your comments, your views, and your questions. So we invite you to use the chat option in Zoom to really send us your questions and your feedback and your comments on what you see and hear. All right, now let's get into the presentation proper and the discussions with our eminent speakers. First, Professor Dr. Ashok Chaudhary, clinical lead and senior consultant at the Department of Hepatology, Gastroenterology, and Liver Transplant at the Narayana Super Speciality Hospital, Gurugram. Dr. Ashok Chaudhary works as the head gastroenterology, hepatology, and liver transplantation at the institute, and also is an honorary professor of gastroenterology and hepatology at KIMS, Bhubaneswar. Previously, he was the associate professor of hepatology and liver transplantation at Institute of Liver and Biliary Sciences, New Delhi. He's a hepatologist, transplant physician, and a clinical researcher using both preclinical and translational studies. He was awarded fellow research by American Association for the Study of Liver Disease at Boston in 2014, Young Investigator Award by the International Liver Transplant Society in 2016 at Seoul, and also by the Asia Pacific Association for Study of Liver in 2017 at Shanghai. Now, Dr. Chaudhary will speak to us on the topic, ability and the inability of artificial intelligence on transforming healthcare. Welcome, Dr. Chaudhary.
Thank you, whole GEC team, as well as nice introduction by Mr. Santosh. So now we'll go to the topic. I think one important message is given that this COVID has made us disruptive, but that has given us a good scope also to do work. And that is how my interest for this area of AI has come up. So, and today we are going to discuss one important area. What I can say is, we know it is a boom, but we have to see how it is going to be happening over the time. So, at the outset, I have nothing to disclose. So, we'll cover in the following few lines. So, as we discussed, why we need AI in the healthcare. You can see the AI in healthcare has either has been used or in trending in all aspects. You can see the basic, that is diagnosis, treatment, prevention, risk tracking, community health, behavior modification, health economy, basic research, health operations, drug discovery, data mining, rare disease. So, and many other areas also needs to be added. So why? Because it is a need-based solution which can be accurate, it can be reproducible, and is the most important is objectified. We can see, so this is a huge burden. You can see. Second important is the obesity. The obesity day by day, the curve is adding more to this fatty liver per se, and per se obesity is a, you can say, factory of disease with us. And diabetes, this is another one. So this is also adding to our rising trends, and it is going through, and you can see the predicted is by 25 is something alarming. And the most important is the childhood obesity, because today's child will be tomorrow's adult, and they are also adding this burden. If you see this age group day by day, this is also adding, and thus all countries are at the verge of adding more of young childs, you can say the adolescents, into the obesity group. So if you come to India, our country has now fatty liver is covering from 8 to 32%, and hence government has to take the action to make a national program including the fatty liver. So why so? AI can cover, it is early detection for treatments, drug developments, and public health initiatives. Because you see, if you consider 8 to 33% of the population is coming around 40 crores of Indians, and it is huge. We need to address either today or tomorrow. And hence, my talk here will be more importance on this, whether this meeting today can focus to make a AI-based solution to this. So this is small development which has come that fatty liver is a disease. We need testing, we need laboratory parameters, which is beyond the reach and also not optimum. Hence, now it is same from the Singapore. They have come up with a study where they have used the AI model for 30,000 peoples, and here they develop a model that is liver first, and this has a very good accuracy. You can see it is 99% accuracy for the liver stiffness or fibrosis. What you tell the liver injury, you can say about 99. That is called activity. Or liver is of having loaded the fat. It is also up to 99%. And this come up with a very simple way of model for prediction, which can be considered the daycare procedures. And this is named as fibrinostics. And this company has already started working in Singapore. The fatty liver is a need-based solution where this forum can think of. Then natural language processing, the brain. You can see the brain, the mind, and the machine has got a marriage. You can see the autism for which already the process in AI has started working. Behavioral changes, suicide preventions, tracking of the attitudes, cerebral palsy support systems, seizure disorders where early prediction of the seizure you can get by activities. Already the apps are there which are coming up. Blind peoples to get support from their surroundings by help of this AI. And the most horrible part, you can say it is good or bad, the mental mapping, you can analyze the thinking process by this AI. So however, with this, they are coming up this way. So one for ours problem is liver failure, where we cannot get when the patient is become drowsy, become unconscious, they met with some life-threatening problems, accidents, something that. And this causes them to reduce their activities where we need high attention. And I think my colleague, Dr. Meher, he is working on this brain also. And this is a simple process of natural language process. And already in your mobile, hey Siri, Google Assistants, Amazon Alexa already there. So I request that with help of these voice first technologies, we can explore more for the liver disease per se and many more diseases which are in the pipeline to be considered. So if this disease we consider for the neurocognition and speech, we can predict the disease, we can predict the outcome, we can prevent them, and this will prevent accidents, predict outcome, and also guide recovery for a coma patient. As you go next, if I think of a liver failure, very often we're getting why I want to highlight here that we need a good model to predict. So this is one of the model we saw on the first slides, then has come up in a big way, and this is what we have done a large cohort of 8,000 patients, and mine is going to be presented in June month at London ESL. So here also we get a prediction model which is having good accuracy close to 80% for these predictions. Similarly, if a person is coming with a liver disease, whether he will develop organ failure or no, we have developed this model which also having good accuracy close to 85 to 90%. So these are the things we need predictions tools. Preferably, we can think of converting smart apps so that it will give disease outcome prediction with a good accuracy. Then most important in hospital health is sepsis, infections, and that is the major killer if you can say in a hospital setting. So AI, if at any cost help us to prevent infections, sepsis early detections, prognosis, and how to prescribe a huge bunch of medications where the interactions happens. So these are the studies. I think this has come from the USA group where they have able to tell these people whether they will develop a infection or no, if there is infection, when it has developed, and before that you can predict that I should do some behavioral change in this group of the patients. So these are the things which are way forward still at the stage of laboratory. To add this is omics. Omics is a genetic we call as proteomics or based this. Here we just take a sample of blood where AI model establish your cell-free cancer biology. You can able to tell about how the infection will respond and how if a cancer is going to treat it. So the major burden of all hospitals, not particularly for the liver and everywhere, is infection, where we can enroll this AI for diagnosis, sensitivity, response, and remote monitoring. Then next one has coming up is the we take medications, we don't know how it suits you. We landed up with a drug-related complications and drug-induced liver injury. In fact, we get 1 in 10. 10% of people coming to a liver clinic is because of the drugs we don't know has caused liver injury. And in fact, this liver injury is rising day by day and over the time because we are more aware of these complications. So just only few studies show that if you get this group of the peoples, we lead a little bit of data analysis on these papers and we can develop some model where we can tell that if you are having such genetic problems, you are taking such medications, your profile is this, then having good accuracy for predicting the liver injury because of any unknown drugs, and that can help anyone. So this is one safe drug app which is just now working good, and hope in future we may get much more with a robust data how to go for this group. Second, we know everywhere how to go for, we do on liver pressure, which is very invasive, like we have to go through the puncture and surgery and a lot of things, and now things have changed. You just go for a CT scan and from that you can measure the pressure. So this is the reconstructed image from a CT. You put them into your AI-based algorithm and you correlate with the invasive parameters, and in future we'll get the virtual only, no need of going for such invasive procedures simply a non-invasive CT scan will going to give these results. Similarly, if you think of a liver cancer, the similar way we can know the liver cancer much before, we can see the response to treatment, and we can guide the treatment and can see. Because why need, if you just see this group of the peoples across the globe with the cancer, it is the lung cancer is the highest, then it is the food pipe, that is colon or intestinal cancers, and liver stands at the third. Is a third leader causes. 8% of the peoples with cancer as having this. This is also a food for thought, how to make it more robust so that we can prevent them before this. So let's join hand how we can go for by imagings. Already this is from analytic group, the Curie, they have started working upon these imaging solutions to predict that there can develop tumors in future or no. And also now we have got pathology based AI solutions to see the tissues, digital imaging, digital pathology, and semi-quantitative estimations and prognostic models, and has been a good future role for the cancer to be detected, to be treated, and to be responded. This is one of the young chap has gone for a disruptive innovation for the community. You can see this is just recently has said he has done simply a pulse oximeter like equipments where we can get all the things for the liver is bilirubin, blood is hemoglobin, for kidney creatinine, and for sugar and oxygen saturation in a single non-invasive way. So these are the things where we can go to the community at a large scope, and I think we need more and more such disruptive innovations on AI based to teach and to reach and to provide services. So these are the very few things what I have suggested here, because it is beyond the scope to discuss all details of healthcare, but these are the few things from my liver perspective and some public health perspectives will go for. So future of AI, we need NLP to be used more robustly. We need physical robots, and that has been shown during COVID to provide services, and also the robotic process automations. So you can see the whole baskets from detection to treatment in decision making. You can get all help and provided also with a monitoring tracking system even towards the end of life care also. And if we get this, how it is going to help the future is the rural health, I can say, where AI has a major need. You see this India, just I have to want the population divide between urban and rural is 30%, 70%, but we get doctors the reverse with 70 and 30. And day by day, the per capita expenditure for health is increasing, both rural and urban areas. But our services in the country is the reverse pyramid. We need to have a more robust primary, then secondary, then tertiary. But what we have a urban robust based, semi-urban based, medium, and rural is very feeble healthcare system to can go through. However, the Indian healthcare is one of the fastest growing across the globally as far as healthcare expenditure and investment is concerned, where we can think of this. If you think of rural, you can get best way, you can think of healthcare clouds, healthcare analytics, payment models, tablet computing, mobile based health, point of care diagnostics, hospital virtual monitoring at home, and you can get regionalization and exporting the health for a commercial opportunities. So my stay on this conference as far as AI is concerned to be affordable and available quality health we can be through AI, and that should be the future to change the health transformation in India. So this will help in nation building, can achieve health for all, provide ground for innovations, provide income generations, bring industrial revolutions, will address unemployment, and so request is to go focus on the rural health from AI perspectives, because it will be affordable and effective self solution in the era at this moment. So if you discuss about these abilities and strengths, what is the problem? Why across all the sectors of AI, health sector, though it has shown a trend, but still not an expectation? Because accountability, ethical and legal issues, I think Dr. Mayor will come as subsequent section. Dr. Ashok Sharma also will address on these issues. The biggest problem is the who will answer the questions if anything happens wrong. with the machine decisions. And another important I want to say that in all AI analysis, there is a lack of a convergence between a technologist and a clinicians, because clinicians can guide with questions and the issues to be addressed. Technology can provide solution, and when both combine, it happens a best way. However, this convergence is needed more often, and hopefully, with boom of this AI industry, it is a need of a fusion between two. And the fear of insecurity as far as data is concerned, data sharing, data analysis is concerned. So here we need a research, we need a robust roadmap with a policy based, so that we can address this issue. And this is the, I think, can say the most important part of AI in health sector to go further. And if as an investigator myself think of doing this AI risk projects, I become too much optimistic. There is always a bias threshold to go on programming running to get the results as we desired, rather than thinking that how the results should go independently. And most important thing is the attention seeking. If you go for a one program today, we go into media, we go into highlightings rather than going to having the sequential serious involvement for this. And next important is the, it should be sustainable. If you develop a model, it should be tested through preclinical, clinical, post-clinical, and post-marketing surveillance to get updates always, so that single project maybe, but you'll get there. And we need to consider with a rational of scientific case, because when data is with you, what happens? Most of the people analyze first the data, then find a results, and then they link it to the clinical outcome. So that is a problematic. So first, you think of a research question, you find the results, analyze them, and then we can go for it the way we think of. So my request to your partnership should be fatty liver, which is the largest in this part of the, I think it is a global burden. Liver cancer, it is third most common, you can say. Diabetes, which is rising day by day. And most important is the childhood obesity, or I can say we can think of a school health initiatives. And obesity device or products are always there needed. So these four, fatty liver, cancers, diabetes and obesity, and child health or school health initiatives should be the future of AI focusing. If you do this, what will happen over the time, that like the Tesla car, to give the system in the hospital and go on a vacations thanks to artificial intelligence.
Thank you. Thank you, Dr. Chaudhary. I think that was really informative, and you really covered the full scope of what AI can do in the 3 or 4 areas that you kind of alluded to and where you focus on. And you really showed us that AI is evolving. It's still evolving. It's in quite early stages still in the use of AI in healthcare. But there is huge potential there, given the scale and the growth that we are seeing in the healthcare industry. But at the same time, there are equal number of challenges that we need to address, which just opens up the space for all of us to play in, as long as we remain ethical and are within legal boundaries. It seems that there is a lot that we can do together in the space of healthcare with AI. Thank you very much for that insightful talk. Yes, we did have a couple of technical glitches, but I'm sure that did not dampen the content and the spirit and the richness of the information that you shared with us, Dr. Chaudhary. Thank you very much for that. We will come to the question and answer sessions at the later part of the seminar or webinar. I would request every participant to think about what Dr. Chaudhary has shared and give us your comments, feedback, and also your questions so that we can get them clarified from Dr. Chaudhary. Now, next up, we have Dr. Sushil Maher. Dr. Maher is heading the Health IT group at AIMS India in New Delhi and has been there for the last 30 years. He's also heading the technical group for making a paperless and filmless institution. He was the honorary joint secretary of IAMI during 2010-2011 period, then the honorary secretary during 2012-2013 period, and finally the president during 2014 to 2016 period. Dr. Maher is recognized as a leader in hospital digitization and biomedical informatics. that provides scientific foundation for models of decision making in healthcare and for medical education. Today, Dr. Maher will speak on digital health transformation through AI. What is the current perspective in India? Welcome, Dr. Maher. The floor is yours.
I'm thankful to the organizer, GC Media Group, and Santosh and Malavika to giving me an opportunity to talk on current perspective in India on AI. Anyway, this is my topic, and right now I'm working a lot of AI projects, which is taken from the grant from Government of India, and that is been under process. Some is going to be delivered very soon. The topics what I've given it, what is the hope and what is the hype and what is the reality. That is also that things I have to speak in my talk. This is the trend what existing is going on, and today we are 2020 plus. So the gene and biotechnology is playing a major role. When it is coming for AI, again it is putting an extra layer to the technology which can be used for the healthcare services. And the trend, what it is that how it is matching with the technology. In 21st century, we have the information technology, then knowledge management, all are in place as a revolving of the technology. And on the other parts, the biotechnology is playing a role during this period of time. So that's why right now they are merging, or they are totally a couple to develop a new system for the healthcare to give a good kind of treatment. This is our health system right now. We are talking about populations where the public health informatics is coming up. When we are talking about patients and their tissues and their cells, when it will be clubbed in the test forms, it will come in the medical informatics and medical imaging. And when cells and the molecule genes is coming up, then you are using the biotechnology. So these are the synthesis of the knowledge of all levels, and that is the future of e-health. Right now, the health, it has some issues. It is not that only the test. You test your blood, you test some samples of the patient, or you take a scanning of image of the patients. No, it is more than that. What is the DNA? What is the genomic sequencings? All are coming up for the good quality of treatments. So in these cases, the whole combinations, it is required to give a high level of treatments to a patient. This is how it is to be available as a health information users. You are collecting the data. Where you are collecting? In your lifestyle. Right now, a lot of instruments has come up. Daily basis, people they're recording their temperature, their the blood pressures, their pulse rates, everything. It is in the device based. It is capturing that, and it is stored in one device. Simultaneously, when we are going for any other hospitals or a dispensary, we are capturing the data, what health I have, what is the history I have, which is being stored in isolation manner. Another one is the patients. Patients, they need a single medical records, which is not available in single location basis. All are in distributed systems. And the data, because when we're talking about AI means you need the data. And where the data will come? It will come from these sources. How it will be integrated? How this data will be come in a single medical record based? That is the one of the challenge, what I mean to say here. This data, when we are talking, when population it comes, your epidemiology. When you are talking about your personal data, you have your own EMRs, it's supposed to be in place. When you are talking about the tissue data, it is the cancer cells, and that can be predict your future, whether you have a cancer or any other chronic disease to become. And cellular pathway data and molecular data with the genomics and proteomics, it is all the data which is being in place to integrate in a single computer grid forms, so that in futures you can use this data as for a prediction, or you can say some quality of treatments that can be used from here. When we are talking about medical records, in that cases, you need the clinical informations and the health informations. So all are in one platform that is being stored in one place where the people they can access it. Another platform is that there's the administrative, where the administration to manage the data for to manage their own organizations. Another one is the supply chain, where if you have a particular kind of disease in particular time, what kind of medicine is required and how much amount of medicine is required, and how much amount of vaccine is required particular that period of times, it can be forecast. So in that cases, demand and supply, it can be managed. And this is the totally a revenue cycle for each organizations, those who are involved in healthcare services as well as healthcare product manufacturing. So when we are talking about the own health, in that case, you want that I have to understand my health. After aging, what it will be, and what diseases might face in near future. And what are the effective health promotion is coming up due to the demands of, let's take in Delhi, it is highly polluted, and more chronic pulmonary cases is coming up. In that cases, the promotion is that how to maintain yourself, and if you get some further treatments or any healthcare supports, where you can get it. Third one is that can I predict whether I have some disease in particular time? How can detect early diagnosis? That is it possible? Is there any innovative treatments which can be given to a patient or caregiver in remotely, or in their any app systems where it can give all the details for the forecasting or predicting, and how you will be healthy to maintain yourself. What will your food? What will be your food? What kind of activities you have to do it so you can be fit always, and how it will be integrated with the public health, which is been citizen-centric care to be given. And third one is the improving the health informations and data explanations and knowledge translations. All the data is coming up, whether these data are meaningful or not, whether this data has standards or not. That is also one of the challenges, how the EMR to be a persons to be created. So these are the basics, informations, and the challenges that you have. Right now, this is the things we are looking towards in the future. Already I have explained about that the 4P, you have to predict it, you have to prevent it, and you have to give the personalized treatment, and you have to participate. You have to participate in the public health. So for this, we need the molecular biology, sequencing techniques, and the medical technology, which is being clubbed with the big data and data processing capacity and connectivity. If we talk about 30 years back, at that time also AI is there. And when we will talk about AI, at that time, the technology was not supporting. We do not have that much of storage. We do not have that much of processing. We do not have that much of networking. We do not have the proper standards of data. So this is the challenge at that time. And today's technology is not an issue. Communication is not an issue. So that's why right now the AI is playing a major role in all the domains. And particularly in healthcare, it is largely people are focusing on it. So this is the one diagram what I'm showing you. We need the lab information, we need the clinical information, we need the your demographic details, you need what type of vaccination he has already been given, you need the what past disease he has suffered, what kind of treatment he has been given. We need the information which the person is towards the some kind of allergic. So all these things it has to be integrated and make a single medical records which can be more meaningful to give a predictions or detection of early any chronic disease to be happen to a patient. So that's why one applications which has been developed and that is being used, that we want to make a disease mapping through the ICD-9 codes right now. It is there, but the ICD-10 it will be converted very soon. So these are the diseases we have mapped it, so we can visualize that I can plan out that this disease is just makes essential for me to take a step what to do. So that's why this is a one dashboard for the administration, hospital administration to take a call on it. And these are the data which has been taken. It is about to be at 1 million of patient data which it has been mapped. So when I'm talking about AI, data is the one of the most important. And if we talk about 30 years back or even 15 years back, if we talk data and I can manipulate the data and get the information. But today it is not like that. From the information we need the how to make more knowledgeable. From the knowledge we have to develop the intelligence. So right now that's why AI is playing a role in major of the sectors, even biomedicals, healthcare delivery, where you can give it, and the disease preventions. We are using all the techniques of the AI where this sort of disease can be preventable and manageable. This is the trend right now. You see in 70 also AI is there, but it was not prominent because of, I have already told you, due to the only thing is the infrastructure. Second thing is that we do not have much data with us. Right now, after 2010, the storage, the last scale of storage it has come up, the huge amount of storage it has come up. People are talking about not petabyte, zettabytes, they are talking about it. So right now it is scaling up to use the data and get the things early so that it can be preventable. So this is the things. In 60s, we are talking about logic-based and or heuristic search. In 90s, it is rule-based knowledge and knowledge engineering and expert system. In 2015, big data difference and automation of learning. But when you are talking about 2045, the age of super intelligence, it is a super intelligence means super AI. It will come up, which right now the technologies they are predicting it. So right now we are on the same path, and we are moving towards that directions. So that 4P, that is we have to preventive, we have to predict and personalized and the participatory. When we'll take any drugs, it is a common drugs for everybody. Let's take, you have sneezing, you are taking some anti-allergic drugs. It is for everybody. But some of the allergy drugs, it is being reactive to you or some adverse effect to your body. So it is not a personalized medicines. Right now we are talking about we have to have a personalized medicines, because if we have talk about our genomic codes where we can see that which kind of molecular medicines can be suited to him, they can be manufactured and they can be delivered. So we are going towards that direction only. Where will be next 20 years? AI obligates major corporates. Every company love you and do have the best interest in your mind. Yeah. Another one is the AI Fusions, the major breakthroughs, the promise. Many promises it has been given. In healthcare also, many promises it has been given. When I'll talk about it later part of my slides, then you'll understand. Many hopes it has given to that, but it has not been delivered yet. Better for the jet intelligence and the national advantage, which is been curious for our secret weapons for the AI in our futures. What will take away? Because one has to be satisfied what kind of treatment he has been given through the technology and what type of treatment and clinical systems they have, which will empower to the AI system to give your right kind of treatment and right kind of prescriptions. Next one is the electronics and data. That is the intelligence computing, which can be complex and expense of the new data sources to push the boundary of the precision care, medicines, and the population health. Right now, we are talking about the mostly on precision medicines, where we can do the personalized treatment and medications. Then how it will be prevented, which the disease is supposed to be have in future. Let's take one example I am giving to you. In AIMS, we have made one study. We have around 60,000 patients, 60,000 employees health services is being given by the AIMS. 60,000. What are the generations? The employee is the one, and he has the dependent of parents. Okay, this is another generations, and he has own kids. So 3 generations is there. So we are taking the data of three generations, and what you are comparing the genomic codes, what is being changed from generation to generations. Then we can observe what is the disease pattern of this employee, and what is changing from generation to generations. Then next generation, what kind of disease can be predicted. So these kind of things we are working in AIMS. Right now, when we are talking about the hypes, so what is actually AI? Whether AI will replace the healthcare system? No, it's not at all. It is a one type of wood that tools can be give a support to the doctors or any healthcare services which are giving it. Let's talk about the medical imaging. There is a lot of AI tools to make the reports from the imaging. And many places, the X-ray has been already not been reported by the doctors. Now the tools it is giving, and that is they are making the reports. Simultaneously, the tools it is for given to your MRI, CT, they are making a provisional notes, reporting notes. And it will be verified by the doctors. It takes less time to do it. Another AI tools, people are doing it because your pathology imaging is always be a crucial information to detect cancer. And sometimes some observation cannot be made due to lack of knowledge, or sometimes it has been missed out unknowingly. So right now, these imagings can be processed through AI tools to get the proper information to the reporting persons, and we can re-verify it, we can put it, so that the accuracy rate will go up. How it will be? The intelligence system often inspired by the biology. If we talk about 20 years back, those who are taking the biology subject, they do not want to study the mathematics. And those who are in the mathematics, they do not like to study biology. But right now, biology and the mathematics, they have mirrored each other, you can say, if we'll talk about the AI. So today's days, it is an interdisciplinary, and this is the one of the interdisciplinary, it is largely required and we do not have that systems that how they will be studied both in one place. Today's governments, they have taken a decisions that you can take multiple subject in different area. It may be a science or it might be a commerce. Both the things can be merged also. So that's why these things has come up. Right now, multidisciplinary has come up to integrate each other. When AI can be used, AI can be used anytime, anywhere, any places. And one example I am giving to you, AI, how it will be. In AIMS, we get around 12,000 patients a day. And out of 12,000 patients, it is around 7,000 patients are first time they are visiting the AIMS. So what we have studied? We have studied around more than 60% patients, they do not know they have to show in which department. So we have a tools, we have watch tools, and when they will take any appointments at that times through that tools, they can guide you that where they have to go and which specialty doctor's appointment is required. So that's why this type of error has gone down. And earlier what it happens, they go to a wrong departments, again that department, they refer to other departments. So it takes a lot of times. So right now it has been reduced to around 10%. What is the public perception about AI? Is it a sci-fi or is something else? Frankly speaking, in my study, I have observed that people have motivated from sci-fi movie to use the AI in their profession. It is not limited to only the healthcare or any manufacturing company or insurance or finance. Recently, the AI is being used in your all other fields like your that is called journalism. In journalism also they have started using AI. So people, they have understand if we use the AI, we can get is one kind of accurate informations that information can help me in their life. Who will do all these things? Particularly in the healthcare industry, I'll tell you. Already Government of India is looking towards this. Today's information I'm talking about it. Ministry of Health formed a special task force to use AI in healthcare, and AIMS New Delhi has been the main nodal center for AI development, which will be used all over the India, not only the government hospitals or government organizations, it will be in private. Where we are using it right now? We are using the analytics works for any kind of analytics works, whether it is healthcare or whether it is any other domains. So that's why a lot of BI tools that has come out. More specialization is required for this, to forecasting, or you can predicting all these things. You can't believe it. When we have used the forecasting of the patient to arrive in particular season, we have developed a tool for this, that how many patients they can arrive particular in that season, so that make our infrastructure ready, make our manpower ready, so that we can deliver good services. And lastly, you can't believe it, we have solved around 70% of our problems. Robotics. Uh, Really, you can't believe it. In healthcare, IT penetration was largely, it is very difficult to penetrate it because IT was playing a major role at that time also, but people are not trying to adopt it because they think we need a special type of training, special type of knowledge, then you can use it. But during the COVID time, it has forced them to do it. That's why people have started, no. We want to use the robotic things to screen the patient during the COVID times. Many places it has been used robotic to scan the patient. After that, they allow inside to the visit the doctors for their treatments. Intelligent medical devices. It is totally a automated systems. We have a one systems in our labs. It is totally automated. Whole lab is totally automated. What we have pre-analytic and post-analytics. Just you have to collect the sample. After that, everything's automatic. The robotic hands, they pick up the samples, they put in the particular testing machines, and they do the test. After reporting, those who are normals reports, it will go automatically. It will approved by the AI tools to reporting. Those who are abnormal tools. After that, there is another tools. It is there. It will be see what is the clinical information of the patient, what past test has been performed, and they will correlate it. If it looks good, then it will automatically be reported. It is not required to authorize by a concerned doctor. It is totally a automated system. And if some doubts is there, then the lab doctors, they have to see it and they have to take a call on it. So this is the automated intelligence devices we have installed it. Another area is the IoT devices. Right now, people they talk IoT, but we talk IOMT, Internet of Medical Things. Major instruments, including your ventilators, it is being integrated with IOMT device. Each and every information of the patients, it has been stored in the own patient records, that is EMR. How it is? It is just seamless, but all the data is very difficult to capture it. We have a AI tools inside. It will allow if there is some changes in the parameters there then. Otherwise, each and every second's information which is being displayed in the ventilators, it will go to the patient records. It is very difficult to make it. So this is the one examples what I'm giving to you. Or any lab equipment, small lab equipments, which is being in the emergency, when the patient comes for emergency or trauma care, they take the sample, do the test, and they need immediately the information. So we have an IOMT device which will be connected with the lab equipment, and the data which generated will transfer to the medical records immediately. And from there, it will be displayed in the doctor's textbook immediately. So this is the seamless connectivity from the lab equipment to the doctors. How we communicate with the systems in a more natural manner. See, when we are doing any EMR records, it is a very difficult part to enter online to the patients. Let's take, we have developed a one EMR, clinical records for the OPD for the gastroenterology. So grabbing the records, grabbing the informations from the patients by the doctor, it takes 35 minutes. It is just impossible to give 35 minutes for the recording all these things. So that's why we have used some AI-based voice recognition systems. first recognition system. So it has been reduced to 10 minutes. And then people have started adopting it. Another one is intelligent diagnosis and the care plan. Many in super specialty places, they are using CDSS. In that CDSS, if the clinical record has come, then let's say he has the high cholesterol, he has already been a hypertension treatment is going on, then automatically the alert will come that please take a consultation with the cardiologist. This clinical decision support system, it will help to the doctor with AI-based tools to give the alertness, these kind of things. Sometimes they can ask also that please do this test also. So these kind of tools, CDSS, which been used through AI to make a more accurate diagnosis and treatment plans. Right now in India, these are the common areas doctors, they use the AI. Managing the medical records and other data. See, the digitization has come last 5 to 6 years in India. Earlier, people are using the paper records. Till date, more than 60 to 70%, if we are talking about clinical records, it is in the paper form. Major government or private hospitals, they are using paper forms. So in these cases, people are scanning this rate, putting a NML tools, retrieving the clinical terminology and putting it in the database. These kind of things they are doing it. Second thing is any repetitive work.
Dr. Sushil, if I may just interrupt, would you be able to wrap up in the next 2 or 3 minutes? We are
I'd
like to allocate time for Q&A from the participants, and there are quite a few questions that have come in.
Sure. These are the areas people have already been using AI, but in very few places. These are the challenges we have. It is very complex. Medical record is very complex, and everybody they are using their own terminology and all these things. Sometimes the administrations or the people they get a threat from the job perspective. The cost is very high if you use the AI because the infrastructure and the which is required and the tools also which is required. You have to change your business transformations through different workflow when you use the AI. We're supposed to have a good EMR which is been meaningful. We have to follow the regulatory which has been given by government. What are the legal issues you have to look into it? What are the liabilities? Because AI it's a major problem is that regulatory issues, which we are facing a lot here. Not in here, in other countries also it is like that. And the human touch, because somewhere we have to use without human touch, you can do it. That is the one of the plus point what we have. Already I have told you wearable devices, which is giving the information to your tools and it can transmit to your own EMR. When we take a birth, we need this kind of informations, genome sequence, the protein sequence, patient profiles, laboratories, everything. It will be in one case. Then we can predict that what kind of disease it can be, because similar type of prototype of things, if it is available, we can compare it and you can forecast it. How will you predict it? If you predict early, then it will be a best for you to take a prevention of this. More than 99% disease, it is, if you diagnose early, it is curable. If you will not detect early, it cannot be curable. So first you have to predict it. Next you have to, can you have the, before the slide? Yeah, early detections. So these two are the boundary which has to be given. If you predict from your birth, at that times it will be better. You can take a proper steps on it. Early detections, I have a cancer. If I detect early, then the treatment is possible and all major cancer is treatable. See, the cancer, when you have a cancer at that time, if majority of the cancers within 12 months, people die. If will not suit to the treatments properly. If we do right time, in that cases, the treatments in the right time when the cancer has started at the time the treatment is given, then more than 90% you will be cured because that will a treatment plan already be in place and successfully it is working. This is the some slides which is being given, but I'm giving one thing to you. AI disease for monitoring right now, largely people are doing it. Even people are using in the ICUs that the paramedical staffs in the ICUs, but doctors in the remotes, they are giving the consultations. If some patient has gone somewhere, anything to be extra medication is required for the prescriptions and the recommendations. So this is the one thing which is being used largely here. These are the places people are using in hospital, clinics, in sub health systems, or somebody is major health issues. They are in the homes, they are giving the remote consultations. In that case, also you are doing it. Even also smart teleconsultation also it is right now, largely people are using it. This is the one thing what I like to say. Right now, Government of India has come up with a single medical records for each citizen of India. So that's why this is the ABDM, Ayushman Bharat Digital Missions ecosystem that has been created by Government of India. So if you give anywhere, any kind of treatment or any kind of test or any kind of you have a device, it can be stored in single record basis. And you can create your own digital records remotely and which is free for all the citizens of India. This is the vision of the Ayushman Bharat digital missions. The health coverage to be given everybody, which can be accessible, affordable, and timely and safely manners it can be used. The issue is the security and confidentiality and the privacy of each person of the citizens. These are the objectives what we have to establish a state-of-art digital health system. The quality of healthcare collections can be done properly. Platform of interoperabilities, that is the health information exchange will be created by the Government of India to exchange the health records from one hospital to other hospital, one service center to other service center. The fast traction updation of the accurate health registry and the prevention to measure the quality of care. So that is also will be the part of this mission. These are the architectures which has been designed by the Ministry of Health. So each and every hospitals, each and every healthcare workers, each and every health service provider, they have to be registered here. They have to integrate it. Right now, it is in the implementation stage, and it will be lively. It is already been lively, but when large people will be involved, then the real issues can be seen, and you will get your single medical records immediately after that. So this is the workflow what they have designed it. If you are doing the teleconsultation also, e-pharmacy also, everything is to become Ayushman Bharat digital missions. So it is not only the government project; it is a project of whole nations. So these are the basic diagrams what I'm talking about. I've explained you. You see the in between the health ID. You have a unique ID. If I am a healthcare service provider, I have another ID. That's why you can see DG ID. So DG doctor. So doctors have to have own ID. So you'll know that which doctor has treated you in which hospital, what time, what treatment has gone up. Everything it will be stored there. So that's why we need a large scale of data where we can use AI tools to predictions. So this is my talk. Over to Ansu.
Thank you. I mean, clearly your passion, your experience, and the work that you have done is truly amazing in this field of technology and healthcare. And it's also fascinating to really see the advances that we have made in digital healthcare and the use of technology and AI in healthcare transformation in India. There is so much that is happening, as you rightly said. There are so many challenges to address, but there is clearly a future, and there is a bright future for technology and its use in healthcare transformation. Thank you very much, Dr. Sushil, for that really insightful talk, where you even shared solutions that the Institute is using and even what we can use in the future. Thank you very much for that. Now, moving on. Thank you. Now, moving on, last but not the least, Dr. Ashok Sharma from the Department of Biochemistry, National Cancer Institute of India. Dr. Ashok is an additional professor in the Department of Biochemistry and posted in NCI, India, in the Jhajjar campus. He received his PhD in cancer biology at the Department of Biochemistry at AIIMS in 2009. He's the recipient of multiple awards, including the prestigious DBT Ramalingaswamy Fellowship and the DST Ramanujan Fellowship Awards from the Government of India. In 2009, he joined the Vanderbilt Medical Center in Nashville, USA, as a postdoctoral fellow and worked on tight junction proteins and their role in regulation of cell migration and epithelial mesenchymal transition, EMT. In 2012, he joined a group of Adam Arkarf in the Eppley Institute of UNMC as a senior postdoc and worked on cancer testis, germline antigen, POTE, epigenetic mechanism of regulations, and biomarkers. He got expertise in epigenetic and gene regulation from, I'm sorry, no, there's a little typo here, and gene regulation. He has published multiple research articles, abstracts in national and international journals. He's involved in EPG Pathshala, a MHRD national mission on education through ICT, venture to develop e-content at postgraduate level that will help to improve the education system in India. Now, Dr. Sharma will speak on clinical application of AI in genomics, current state, and future directions. Unfortunately, due to personal reasons, Dr. Sharma is unable to join us live, but he has sent us a video recording of his talk.
Good afternoon, everyone. I regret I am not going to present my talk online due to some urgent meeting. The topic of my today's talk is clinical application of AI in genomics, current state, and future direction. As you know, artificial intelligence basically is a simulation of human intelligence processed by machines, especially for computer system, and it refers to multiple technologies involved together. So deep learning, machine learning, all together help to understand the languages and knowledge representation. So all together collective artificial intelligence. So you see, artificial intelligence play crucial role in genomics because it's an era of artificial intelligence and genomics. So genomics play very crucial role in early detection and diagnosis, and artificial intelligence basically help to interpretation and integrating the predictive method with growing knowledge of the genetic diseases. And that also helps along with the machine learning and experimental biology, which are conducted in the laboratory. So that will help to predict the molecular effect, genetic variation, and that which lead to the development of the new early detection biomarker and interventions or therapies, which help to make a better treatment of the patients. So let's know what is genomics. Basically, genomics is the study of all the genes. Genes are the unit of heredity, which including the interaction with different genes and their environment. Because environment also affecting the gene expression, phenotypes. That branch of genomics is called the epigenomics. So artificial intelligence play very crucial role to understand this complex structure, and with the help of high performance computing platform. You see, a lot of data are generated through the next-gen sequencing, which are stored in the TCGA, which is NCBI data platform, and we use the Hadoop ecosystems, and all this data we are stored in the genomic analytic environments. So where NGS tool we are using, cloud system we are using, GetTech systems, and all this data with the help of using machine learning and artificial intelligence will help to predict the risk of the disease and prognostic markers and how disease are progress. So this real-time data we will get with the help of by using the power of artificial intelligence. So genetics basically associated with the different diseases, like every tissue have 20,000 genes, but all the 20,000 genes are not expressed in their particular tissues, organs, because there are a lot of factors like chromatin state, promoter, enhancer, insulator. So all these factors are play a very crucial role in regulation of the genes. And these genes, after strict regulation, are given producing the different phenotype proteins which give the phenotypes. These genes are under the further regulation of microRNA, long coding RNA. And these phenotypes affecting the metabolomics, the particular drug response, and along with the environmental factor. So these all factors are lead to the condition like disease or cancers in the subject. So how we interpret the genome basically. So as we know, there are all the individual more than 99.9% gene are same. Only 0.1% are different. So these different 0.1% gene basically make a difference. Like for example, in the twins have the same genetic makeup, but some twins cause get the disease like cancer. Even they have similar genetic makeup, but still they get the disease like cancer or diabetes because they are environmental factor which lead to the epigenomics changes. So how we understand that? So they are the latest technology like next-gen sequencer platform are available in the laboratory. We sequence the DNA of the patients, and by using the bioinformatic tools, we analyze the SNPs and neoantigens and mutations. So all these informations, when we using the artificial pipeline and computing them, that will help better understanding of the disease in the patients. So how, what are the different advantages of the AI-based method? Like AI play a very crucial role in the early diagnosis of the disease and preventive medicines like screening tests. Breast cancer like BRCA mutation are there. If we using the BRCA screening, so we protect the young generation, daughter of the mother, we have the breast cancer BRCA positive. And similarly, precision medicines, like we give targeted therapy to the patient by using the potential of the artificial intelligence. And adverse medication effect, drug interactions. We also save the life by adverse drug interactions, and same time, sadly, we reduce the cost of the because and cost increased by the device, the formulation discovery. When we using the power of AI, so cost automatically decrease by discovering the new molecule or new therapeutics. And population health, like in India, the highest cancer incidence in the northeast and lowest in the west. So whose difference in the same country? So we need to understand the cause why some area in our country has a very lowest incidence of cancer and some area like northeast have the very high incidence of the cancer. So AI tool definitely help very useful to understand these regions in our country. So how artificial intelligence will be used to our clinics? You see this slide. So basically, artificial intelligence in nutshell, like it's composed of like machine learning along with deep learning, natural language processing, and cognitive computing. So all these together will help for the early prediction of the disease, diagnosis, integration, what are gene composition there, by using bioinformatic pipelines and genetic testings we implement that, and by using pharmacogenomics, which drugs are very effective for the particular patient or which are not. So that help in the development of the precision medicine also. You see the representative healthcare AI role in the diagnosis. So like AI play very crucial role in the coronary diagnostics, cancer diagnostics, and neurological disorders. So this field is emerging field, is an era of artificial intelligence and genomics. You see here, this is a study published in the Lancet. That data clearly indicate that now cancer is the first cause of death in lower income country and middle income country. Previously, heart cardiovascular is the first cause of death, but now cancer is the first cause of death. So we need the early detection biomarker and better treatment modalities. So AI definitely help in this area also. So you see here, like tumor sample, we collect the patients, the cell lines, and these tumor sample we are sequence and look out the signature gene expression. Their indels and copy number variations are there by different tumor markers. So and what are the different mutations are there. So all these like genomics and bioinformatics by computing with the artificial intelligence help the clinicians and scientists to give a better precision treatment to the patients in early stage of the disease and we save the life. And you see pathology. Artificial intelligence also help the pathologist to make a decision. So basically, artificial intelligence help in the early predictive and prognostic applications. They help the development of the training system and reporting system, which help to the pathologist to take the decision. So in that way, artificial intelligence also play very crucial role in the pathological decision making system. And in my laboratory, basically, we are working on the ovarian and breast cancer and on AI. So that is some representative data. We are using the deep learning method to make a early detection prediction of the different ovarian cancer subtypes and breast cancer. We are using this flow chart in the medical imagings, like we train the system by collecting the and annotating the data. We label the data with the help of radiologists and pathologists. We extract the features of particular patient, we labeling them, and then we make a model. So after we are at present, we are under the process of making a model. Then next step, we are validating the models. So this experiments, this project is going on my laboratory, and they are the training data, like we collecting the imaging data from the public data set as well as from our patients, and we are this imaging data we collecting the all the property of the tumor, and like we are also keeping the eye on different size of tumor, their contrast, brightness, their size. So and after that we annotating this data and train the supercomputer. After training, like we are in the benign or malignant. So like the small kids, we need to teach them like alphabets, A, B, C, D, F, G. Similarly, in the supercomputer, we need to train them, teach them. So after that, they have the reach the stage where how to take a decision. And this is the feature extraction modeling system where we put something that input data and we extract the feature from the clinical data, imaging data, histopathological data, and then we further make it classify. This is the pre-process and labeled imaging will be trained a deep neural network which help to classify the tumor image in benign and malignant. So similarly, you see this slides. So now after testing the model, train the model, the next step is the validate. So we are not reaching that stage. We are currently working to train the model and we collecting all histopathology, molecular profiling, clinical data, and imaging data and train the system. Similarly, along with the histopath data, we also using the ultrasound images. So we correlate all the data together and make system more robust and precise, which help to diagnose the better way. So after we put in that one, as we know, the biology is a very complex of any disease. So along with the all this imaging and pathological and clinical data, we try to utilize the genomics and epigenomics signatures along with transcriptomics and proteomics, metabolomics. We try to collect all this data and integrate all these clinical data sets and train the model which help to make a better predictive model and model for the disease. So here you see this figure. They are like the different coordinates of the deep learning. So all these informations are put in the deep learning and make a functional annotation of the human genome, make a prediction of the disease associated mutations, and finally, which help to make a early detection or disease diagnosis or make a better drug discovery models. So these are timelines where history of the genomics and genetic research going on, and along with that, their genomics basically is a these days is a revolutionary in the healthcare. Like at April 2003, Human Genome Project are launched. So last 15 years, more than 20,000 genes are discovered, lot of non-long coding and other information we got it. And these information, by using the help of AI, we are under the process to utilize like genomic information and their clinical use that will help early detection and therapeutic decision making. So genomics is a very revolutionized the healthcare system. And but still, along with that, there are a lot of challenges for the cancer genomics and data interpretation. Biggest challenge in the cancer like heterogeneity. So a lot of heterogeneity in there. There are different type of data infos and difficulty in the integrated of the analysis. Second problem is the data generation and sequencing platform. There are different sequencing platform. There are different chemistry and different computational pipeline. We need to make a standardized. So well-designed studies with casual interference are needed to filter out biomarker and strong correlative effect, but no real causative effect in the tumor disease. So that are the different challenges are there, and this AI along with that also help in the drug discovery, like new therapeutics, new molecule, new vaccines, new antigen-based vaccines. We need to design. So AI play very crucial role in these directions. So keeping all this in mind, Government of India recently developed new National Cancer Institute, a 5,000 crore project, which is inaugurated by Honorable Prime Minister Sri Narendra Modi ji in February 12, 2019. So this center main aim is completely translational research.
Thank you, Dr. Sharma. Clearly, the future of healthcare is truly bright. AI is going to play a more than ever important role in the whole healthcare value chain, right from, as you said, the early part of the process to the real end of the process. The entire value chain is going to be augmented with technology, augmented with AI-enabled systems, processes, and at the same time, the evolution of all the digital technologies, as Dr. Maher mentioned before, has helped in really driving the adoption and use of AI and big data in the field of healthcare. Thank you very much for all your insightful and provoking talks, and also for sharing some of the really good examples of what we are doing in India today and what is coming up in the near future. Now, after this insightful and provoking talk, it is time to see what questions we have. We did get a couple of questions from the audience. Maybe Dr. Maher, if you can come on screen, this is a question probably that you can help answer. Healthcare is a highly regulated industry, and I think you alluded to that in your talk as well. What are the implications of the regulatory framework for the government and the industry in equitable use of AI in healthcare? And maybe you can also touch upon the legal and ethical aspects, because that also weaves into the entire framework that we are talking about here. Can you shed some light on this topic?
Yeah, definitely. Yeah. See, in my talk, I have already told you about the single medical records, and that is in the digital forms. So why it is digital forms? If it is digital, it can be shareable. Then the fundamental of digital record is that who is the owner of medical record? The owner of the medical record is itself patient. Without concern or without any permission from the patient, you can't do anything in that record. Whether it be a research, whether it may be a study purpose, anything, you can't do it. That's why we need a regulatory that this data, how it can be used. One example I'm giving to you. Let's take, we have taken a blood sample of a patient, and that patient test has to be done. Let's take TLC, DLC, and RB. But you can't use this sample for other tests without taking the consent from the patient. So when the regulatory test come up, then you have to ensure that what is the personal data protection bill has to be in place. In India, yet it is not. That is in the parliament for the approval, yet it has not been approved. If this will be come, then we'll get a roadmap that how this data can be shared. If the data cannot be shared, already I have told you the patient is not getting the treatment in one place. He is moving from hospital to hospital, means different services is taking different places. That record has to be accessible. And when it will be accessible, when the personal data protection bill is supposed to be in place. And that is not been done. So that's why your data is not in one place to be place it is been placed. So if you use AI tools, it may not be accurate that much what it's supposed to be. So you're supposed to need a complete data first. Second thing is that what data, what the records supposed to be like that. What standard you have to follow it. That is in place. In India, already been directed to the all the service provider that you have to use SNOMED city, systematized nomenclature in medicine on clinical terminology. Majority of them, they have already been adopted, but it is a big challenge. Many people, they do not understand how to use it. This is one of the clinical directions. Another direction is the lab directions. In the labs, the nomenclature has to be uniform. So that's why, again, government has given the regulatory that you have to follow the lowing standards. So these are the different standards already been placed about the radiology information. So all the imaging supposed to be DICOM standard in DR forms so that it can be easily moved without losing any image data. This is the few points I have. So over to Santosh.
Thank you, Dr. Sushil. I think that's actually interesting, right? On one hand, we need regulation. On the other hand, we need education. And on the third hand, we actually need governance and enforcement of those regulations and framework in order to really make it a sound structure that can be implemented so that on one hand, patients and all the data that is collected can be securely handled. And on the other hand, as individuals, as patients, and as as patients, we can feel confident that our data is handled in the right way and for the reasons that I have authorized for. That kind of confidence needs to be developed in the entire system in order to make it successful. Thank you very much, Dr. Maher, for taking that question. Maybe Dr. Chaudhary, the next question goes towards you. The other day, I was listening to a podcast, and their WHO stated that almost 50% of the world population today, even today, does not have access to healthcare. And this is, again, depending on the maturity of the country, and is different in different countries. Some countries like India, I don't know whether it's 50% or higher, but it's clearly that almost 3 billion people around the world does not have access to healthcare at all. In your view, what role can digital and specifically AI can play in bringing access to care for the people around the world where it is absolutely needed? And I think it was in your talk that you mentioned to the rural part of access to healthcare. So if you can just allude on that.
I think that is the whole you should think of. In fact, that is the need of 50% is rightly in India, maybe it's 70%. It can go geographically also different. So definitely health need is there one. What is there one? Now you have seen that balloon. Now the balloon is having all the Wi-Fi system. It's going to remote village, and there people are getting benefit of Wi-Fi services. Similarly, the robot has drone has delivered medications at the remote village, vaccines also. This is also, it is part of like this. So digital health is going to make a big changes. what I can say that it is a early warning signal. Suppose if like that one last year Park someone has developed a ECG machine which can be read by the mobile. Now mobile phone user is increasing, and it is now the rural mobile use is more than the urban. Because of this 70% people lie in the rural areas, and smartphone is a fancy and the population is increasing. So where you can think of digital health is going on. So I have shown a few apps also there. Now you can get sickness index. At least by a mobile photo, you can go through the some face, attitude, behavior, something. You can get the early warning signal. So lot of things can be there which don't need any hi-fi technologies, but it can go for. Suppose one now come up with having a sickle cell. Sickle cell is a disease where the bigger people's, particularly in the eastern India, it is a very huge crisis. Now what can happen? Doctors don't know. So what will do? A lab technician can take a blood, put a smear, and take a photo and send to the cloud. It can get analyzed. It can come up. So if you think of a rural health need, I can say as a basic support, you can do lot of things. Suppose I can say the consultations. Telemedicine, particularly during COVID, has showed the way. Suppose a remote village, people is not able to access the health, maybe in the Himachal or somewhere in the digital part. But if he has a mobile, he can go for a teleconsultations. He can go interactions. How it happened? It is because of telemedicines, or it is because of digital health. So it is the digital use, the gadgets use expanding, and it is also reach the rural part of the country. Now we have to think that how our digital attitude to be robust so that we can reach them people, we can teach them, and they can get the benefits. So definitely it will definitely bridge the gap. When we are not able to find a solution, we can go for. So that's why I am very much optimistic, and hopefully Mr. Santosh, you are being in Siemens, you should come up with good innovation ideas. So what I got of idea, just see that ultrasound, we need an expert person, you need an expert machine. Why need? You just make a wearable belt of ultrasound. The picture will be taken, the pictures, it go to the cloud, and it will be analyzing the city. You can get the reports. So there is a lot of things can happen. If you discuss ideas, it will be hundreds or thousands of ideas. We need to focus it. And the whole, what I can say, the AI or digital health, if you target to the rural health, then it is the future for them, because India is a developing country, or you can say the most of the countries except the developed part, and it is a need, and where you can show a difference. That's I can say.
Thank you, Dr. Maher. I mean, and you really touched upon some of the very critical elements here, right? On one hand, there is already existing technology. What we need to think about is how do we use them? What is the real need? Where the need is, and how can the existing technologies be deployed, on one hand. On the other hand, the new technologies, the new capabilities that are being enabled with AI and with the newer digital technologies, how can that address some of the shortcomings in the existing mechanisms of delivering access to care across the world, not just in the developed part of the world, but also in the rural part. Thank you very much for that insight. What fascinates me here is the fact that both of you and Dr. Ashok, both of you alluded to the fact that we need the ability to use these digital tools in the most effective manner, right? So it's not just about collecting data and using. We need to really think about how we can use this. So on one hand, an ecosystem needs to be created of solution providers, service providers, clinicians, doctors, and everybody in the healthcare, let's call it the healthcare fraternity, in order to really come up with ideas. So a collaborative effort is needed, clearly. And on the other hand, strong education is needed. Now, when we talk about key success factors, and I think in all the three talks, somewhere or the other, I picked up this factor that people play a critical role in this whole thing. It's not going to be AI and technology on its own. It's always going to be a hybrid approach. It's not going to be that machines are going to make decisions independently. We will still need human beings to be playing a complementary role in using that data and the outcomes that are generated from these technologies, right? So When we talk about that, people being the center of it, the adoption and use becomes critical. What, in your opinion, is the current state of readiness in India amongst the healthcare workers, including doctors for that matter, especially when we talk about the newer technologies, right? And what do you think needs to be done more in India and maybe even around the world to leverage this technology? Maybe we can start first with you, Dr. Sharma, and then maybe Dr. Mayer, you can add a couple of points on this.
I think most of the doctors are accepting this digital to be considered in their practice, and they are leveraging technologies. You can see that the telemedicine has a big jump. Now you can see the laboratory reports also. The doctors may not have a time, they get the track, they get the analysis, they get the warning signals. So now it is everyone is using that way. Third, you come to the just simply say BP instrument. BP instrument is initially it is manual, and now I can say that it is 80% will be a digital. So every day with time change, the technology is accepted by the healthcare professionals in all accepts. See, most of the laboratories now, one interesting I can say is about radiology, teleradiology. But you can say that with the limited facilities, limited experts. So ultrasound or CT scan images has been shared over the clouds to be reporting from distant place. So a lot of things has been taken care by the medical fraternity. So definitely I see that there is a way forward, and it is going to increase over the time day by day.
Thank you, Dr. Ashok. Dr. Mayer, would you like to add on to that or build on it?
Telemedicine has been introduced since 1999, but it has not been used because there is some technology cultural gap between doctors and the technology. In my study, which has been published in one of the renowned journal, that attitude and the adaptability of telemedicine in India, and you can't believe it, neither the patient is interested nor the doctor is interested for it. Doctor is not interested because they are overloaded, because the ratio of doctors and the patient is very high. So that's why doctors do not have the time to give it. And there is no business model where you can use the telemedicines, so which can encourage to people. But thanks to the COVID, it has changed the total scenario of right now. Right now, doctors are saying, if the patient is not required to come physical, why he will come? So that's why in our OPD dashboard, we have two options. Whether you have to come physical or whether you have to come virtual. You have to choose. For choosing it, I have already told you that if you fill some clinical information, they will guide you which doctors and it is required for the physical or not. So this is the one thing that has come up. Second thing I'm talking about it, Government of India right now here they have adopted another application telemedicine that is eSanjeevani. eSanjeevani, it is developed by CDAC. Largely it is implemented throughout the country. What is the leverage I'm talking about it? You can get teleconsultations, any doctors who are registered here. So that means if you are any rural place, you want to have a consultation with a very specialized, super specialized doctor, which is in the Delhi or Bombay or Bangalore. So you can take a consultation. Earlier, that connectivity was not there. Right now, it is there. In my talk, what I have told you, that ABDMs forcing all the health workers, service provider, they have to register. When it will be registered, what it will happen, so you see, you will be in the list, and those who want to connect to the particular doctor, they can connect easily. This is the one thing. Second thing is that, again, the government is planning to use the GIS-based, geographical information system. Let's take, you need a nurse for your mother, and for 2 hours, you need a nurse. To whom you have to talk? You have to talk to agency. Now government is saying no. If nurse is available nearby, the data is with us. You can see it there and connect to them, whether he or she can give the 2 hours for you or not. So this is the one thing, it is coming up and changing when digital revolution is going on. and simultaneously regulatory. Yeah, of course, regulatory is a part, one of the things. And very fortunate, in 2020, in COVID times, India has placed their telemedicine regulatory, which has been approved and has been implemented. So this is the one another things we have got it. So it is ethically and legally it is approved. Thank you.
Great. That's amazing, right? I mean, there is so much. Again, it's really interesting to see how things changed over the last 12, 24 months, and the acceleration was very high. Long way to go still, but there is hope, and there is a lot of potential in the use of technology and AI, specifically AI-enabled technologies in healthcare. Now, there are a few more questions. What I would propose is that we may answer some of those questions via the different channels and the media that we have. And Dr. Maher, Dr. Chaudhary, and Dr. Sharma can answer those questions, and we will share it as a response as part of some of the ongoing media channels. But at the same time, before we wind the talk for today, I want to ask one question to both of you, since both of you are here with me. Just in very short, maybe in a couple of words only, what would you personally like to see fulfilled with AI in your lifetime? What would you like to personally see fulfilled with AI in your lifetime? Since I see Dr. Maher on the video, maybe you go first, and then Dr. Chaudhary.
See, when we talk about AI, definitely the OPD screening was the one of the real lifetime experience I have. See, many appointments has been cancelled, but right now we have forecasted it how many appointment will be cancelled. Possible cancellation is there, so that we can overlimit it accordingly. This is the one of the plus point. Second thing is the screening of the patient, that they have to choose which specialty and which doctor. So these are two things what I feel it is more successfully implemented.
And Dr. Chaudhary, what would you like to see fulfilled actually with AI and technology?
Basically, I have shown one of my abstracts already. So I am working around in a couple of projects on this area. One is first the prediction models for the liver disease, and now we are thinking of some computer vision aided projects. I think one also have discussed with Dr. Meher already. And third, we are going for the few devices on this AI based, and which are also in the pipeline. But I hope we need help from you guys to make it more refined, so that we can make it. So already I am into the field of AI and working it, and so we can make collaborations, clinicians, and as well as the engineers, so that we can make it much more robust way. And definitely we are going to give some solutions, and that is readily usable in our practice day to day, what we can use with the help of AIs. Maybe it is any matters we can think of. There is millions of questions which would be the more appropriate and should be more appropriate. And I hope through this I came to know a lot about the government schemes and facilities by Dr. Meher also. So in that way we can foster. And important one thing I can say, that when I go for any talk in the doctors forum, AI we don't need. We have natural intelligence is enough. So that is still now a roadblock. We need to think that way. Similarly, when things are come up, but everyone is accepting, because now you're all mobile and gadgets, all AI based. Still we are accepting. So that is not the things. Always we go through three phases. It is first is opposition, then ignorance, then it is acceptance. So things will happen. We need to focus more, and I do in my practice, and I hope we should combine together some efforts to bring something more refined today. Thank you.
Thank you, Dr. Chaudhary. And on that note, really, I think you summarized the whole aspect of use of technology and how we can leverage and go forward with it in a very nice way, Dr. Chaudhary. Thank you very much, Dr. Maher, Dr. Chaudhary, for joining us today, and Dr. Sharma for your recorded session. All the three sessions were really insightful. And as you see, we really overshot our time, and we have a lot of questions on our table. and we can go on for hours and discuss these topics. All I can do is encourage all of you to continue thinking about how we can do this together, how we can make the difference together. So please join me in thanking Dr. Maher, Dr. Chaudhary, and Dr. Sharma for that session. Thank you very much. I learned a lot, and I'm sure all of you did too. I look forward to further and future engagements and future successes of AI and healthcare in India and all over the world. Thank you very much. Have a good day and a good weekend ahead. Bye for now.